Hello, friends. Now, welcome to our next question on our series MCQ for you. I'm Dr. Amit Desai, and I take lectures in surgery for FMGE and also NEET PG. All right. So let us look at this question. A 21-year-old woman has a 3 centimeter node in the lower deep cervical chain on the left side. All right. Now they did a biopsy and it is showing normal thyroid tissue in the lymph node. Now, what is the diagnosis? Now, what have they given us? Subacute thyroiditis, metastatic carcinoma, Hashimoto's disease, and lateral aberrant thyroid. Now, remember, it's very common for us to think that this could be something called as lateral aberrant thyroid. Now, what do we mean by lateral aberrant thyroid? All right, let us see on this page. What do we mean by lateral aberrant thyroid? So, earlier, what used to happen is that people used to come with a swelling in the neck, okay, that would look like a lymph node on clinical examination. But when one did a biopsy of this node, they found that this was a normal thyroid tissue, which is very similar to what has been given to us in this particular question. So these people used to call it as lateral aberrant thyroid. They was called as lateral aberrant thyroid because they felt that during development, some kind of thyroid tissue went laterally and then developed. But today, in today's world, we know that this does not exist. This is not the case. What we actually see is that it is a metastasis from the papillary thyroid cancer. All right, it is metastasis from papillary thyroid cancer. So what we talk about as lateral aberrant thyroid is in fact a metastasis from the papillary thyroid cancer. Now, some points about papillary thyroid cancer. It is the most common type of thyroid cancer. All right. It's the most common type of thyroid cancer. It is that type of thyroid cancer which has got best prognosis. It has got best prognosis. All right. Now, how does it spread? The spread is by lymph nodes. All right. And it is a multifocal type of cancer. Is a multifocal type of cancer. What else do we know about lateral papillary thyroid cancer? Another thing that we know about papillary thyroid cancer is that what are the risk factors? Very important. In the exam, they might ask you certain questions regarding risk factors. So one of the risk factor, which is very important, is previous history of radiation exposure. Previous history of radiation exposure. Okay, if there has been radiation, say for lymphoma or some other conditions, once upon a time, even for keloid, they used to give radiation. That could be one of the risk factor. The second risk factor is a thyroglossal cyst. So if they ever ask you which is that kind of cancer which develops in thyroglossal cyst, the answer is papillary thyroid cancer. All right. Another thing that is important about papillary thyroid cancer is that the tumor marker that we get over here is thyroglobulin. Thyroglobulin is the tumor marker. All right. And what are the histopathological characteristics of this? As the name suggests, there are papilla. Okay. There are papillae. Now, what happens is that these papillae grow or rather outgrow their blood supply, and hence there are dead cells at the tip of the papillae. These dead cells are called as Samoma bodies. And if you look at these cells, you will see that the cells have a dense nucleolus and a clear cytoplasm. So they look like the eyes of a cartoon character called Orphan Annie. So that's why they are called as Orphan Annie eyes. All right. So these are important things that we must know about our papillary thyroid cancer. Okay. And remember, there is nothing like lateral aberrant thyroid. There is papillary, it is basically metastasis from the papillary thyroid cancer. All right. Thank you very much. If you liked this video, then for more such MCQs, more such videos, please subscribe to our channel, ADSL Academics. You can like this video if you like it, and you can also press the bell icon so that you will get notification for the other videos also. Thanks a lot.